My name is Mike Ast, and I'm a hip and knee replacement surgeon at Hospital for Special Surgery. Most patients who come to see me have arthritis of the hip or knee. This is usually something that's come on over time, has been getting a little worse, and is not really responding to some of the other treatments they're trying, like medications, injections, or physical therapy. It's important for patients to understand that not every hip or knee replacement is exactly the same, and there are some very, very complicated problems that we can see in hip and knee replacement surgery, whether it's a first time or whether it's in revision surgery. It takes special training to treat patients like this, and I was lucky enough to train right here at Hospital for Special Surgery on treating a lot of these problems. Now, I'm not the only one who can do it, but it's very important for patients to understand that if you have a more complicated hip or knee problem, be it before joint replacement or after joint replacement, you really want to see someone trained to handle that level of complexity. When patients come to see me, I want them to feel like they're seeing someone they can trust. I always joke with my patients that once you're my patient, you're my family, and we're in it for the long haul together. One of the focus of my practices for the last several years has been rapid recovery and outpatient joint replacement, which is the idea of coming in the morning, getting your hip or knee replaced, and going home on the same day. While this sounds radical to a lot of people, it's actually been done in the United States for almost 20 years. So robotics in joint replacement surgery really works such that when you're trying to make a surgical move, it makes sure that that move is done exactly the way it was planned, exactly the way it was supposed to go for that individual patient. Growing up, I was a gymnast. I used to get hurt all the time, and my orthopedic surgeon was one of the biggest influences in my life. As I went through my orthopedic training, I started to do joint replacement surgery, and I really enjoyed being able to be with patients through that journey and getting to watch them feel better, get back to activities, whether that's taking a walk, whether that's playing sports, whether that's just sitting on the ground to play with their grandchildren. It's really been an absolute privilege.